From aviation to the health sector, the mass exodus of nurses from Nigeria for greener pastures overseas has remained a major problem facing the health sector and has severely impacted Nigeria's healthcare delivery system. This has over the years been driven by factors such as meager salaries, poor working conditions, and limited career prospects. Against this background, Trust TV's Adamu Imam spoke to health stakeholders in Bauchi State on the need to address these challenges. The report.
Many nurses are seeking better opportunity abroad, leading to shortage of manpower, hindering the delivery of quality services both in tertiary and primary healthcare system. Recently, the National Association of Nigerian Nurses and Midwives says over 75,000 nurses and midwives had left the country in the last 5 years. Experts have therefore advocated an increase in the number of nurses through better policies, saying they are critical stakeholders in the healthcare value chain.
The controversy that existing between the Labour and the federal government, these are some of the areas that need to be addressed. And I think by and large, the federal government is working toward that. However, they need to intensify their effort to see the realization of this. And this is going to subdue the situation in as much as what the federal government is giving them, as well as the state government is giving them, we are going to subdue most of the exodus.
But we in Nigeria, we are neglected. That is why most of the nurses are traveling outside for the welfare, because taking things that they are giving nurses is not enough. It's not even enough for them. So that is why they are traveling outside the country to get better care.
Associations have always tried to show the government that these people are not supposed to be leaving the country, because leaving the country is not like a loss to the country, because you cannot be able to train them. After training them, they're supposed to stay and work for the country, but they are not staying for the country. And still, our health centers are looking these members to work for the center.
They added that the impact of this movement is not far from increase in the clinical workload, as well as reduction in the quality of care given by nurses who remain, while the federal government had tried to introduce service bonds to hold health personnel in the country for some years after training before they can work overseas. This seems not to be a workable solution, leaving authorities to think of better ways to address medical brain drain. Adamu Imam, Trust TV News, Bauchi.